Through research, our needs assessment committee, survey responses, and personal interviews, we were able to construct a needs assessment to give us a picture of the current food insecure population in Utah County and some of the reasons believed that it continues to be an issue. We quickly discovered through our research that not only does Utah County have the second highest poverty rate in the state of Utah, but that 14% of the population of Utah County is faced with food insecurity. These statistics help us begin to address this issue of food insecurity we want to improve. Amy Beanfield, the 211 database manager for United Way 211, was able to provide us with data specific to Utah County from their helpline call center. Of the 11,123 phone calls to 211 in the state of Utah this year, about half of those calls were categorized as food and meal related from Utah County. Collecting data from the 211 Utah mobile phone app, Beanfield reported that of the users that documented their location, there have been 6,330 visits to the food category from Utah County this year. Also reported by Beanfield from their callers for the state of Utah is 70% of callers were female, 53% of these homes have children, and 50% of these callers are currently receiving some sort of government assistance, which includes SNAP-Ed or food stamp participants. In conjunction with our assessment of food insecurity is our research on why this is an issue that needs to be improved. Food insecurity has been associated with multiple mental, social, and physical health concerns for all members of the family. From 2001 to 2003, a survey was conducted on mothers of 3-year-old children. The study concluded that of the families identified as food insecure, 30% of the mothers had major depressive episodes or generalized anxiety disorder. Another study published in the Journal of Nutrition in 2011 researched increased percentages of hypertension and clinical diabetes for adults in food insecure households. Whether food insecurity is a cause or effect of these traits or not, food insecurity can be a stressful situation for parents needing to provide for their families and can add to the difficulties they may already be experiencing. With regards to children, pediatric psychologist Maureen Black states in her article Household Food Insecurities: Threats to Children's Well-Being that household food insecurity has insidious effects on the health and development of young children, including increased hospitalizations, poor health, iron deficiency, developmental risk and behavior problems, primarily aggression, anxiety, depression, and attention deficit disorder. From this and other data collected, we discover that some households are seeking for help, yet they do not know where to find it. We also discover that food insecurity can have some immediate and some long-term effects on individual family members. We concluded our needs assessment by understanding that there is a real need to reach out to families who suffer from food insecurity by ensuring they have the knowledge and understanding they need to make healthy food choices, even in the midst of their personal difficulties.